This video shows the technique of excision of a malignant ovarian tumor. This patient was a 13-year-old girl who had a malignant ovarian tumor which had ruptured intraperitoneally, leading to hemorrhagic ascites. 3 ports were used: the umbilical trocar for the telescope and the right and left supraumbilical for the hand instruments. The abdomen was distended due to the ascites, and leakage of fluid can be seen when the umbilicus is entered with the knife. The umbilical trocar was inserted and suction was applied to its outlet to evacuate the ascites as far as possible. You can see the leak of fluid from the open port of the trocar. It took about 15 minutes for the ascites to be evacuated so that a pneumoperitoneum could be created. Inside the peritoneal cavity, we still see a large amount of hemorrhagic ascites, and sitting outside the pelvis, a large ruptured malignant ovarian tumor. Now, as you can see here, the tumor had ruptured and mushroomed out on the superior surface, and there was intact ovarian peritoneum and capsule on the inferior surface. And this was used to elevate the tumor to try and get at the pedicle, which you can just see coming into view behind the instrument there. Once the pedicle had been visualized and it was seen to be quite narrow, it was felt that laparoscopic excision would be possible. The issue was to use an instrument which could coagulate the pedicle securely, as there were bound to be large vessels in it, and we chose to use the power blade, which is a bipolar coagulator with an inbuilt cutting instrument. So the first cut was made, and apparently a couple of the vessels had not been completely coagulated, so the pedicle was re-grasped at the proximal end to coagulate further. As you can see, the sheer bulk of the tumor was making handling a little tricky, but eventually getting a grasp on the capsule just above the tumor shows you that the pedicle is actually quite thin and amenable to coagulation and cutting. There could be an argument for the use of the harmonic scalpel in this situation areas, and as we know, the harmonic sort of coagulates and cuts at the same spot, and that could potentially prove risky with the large blood vessels of the titan pedicle, and it had to be put on stretch to be divided adequately without bleeding. It was just a question of getting the thing done in the most convenient way possible. So that's the first blow for freedom there. Part of the pedicle securely coagulated and divided, and we proceed to do the same to the next part. As you would have noticed, the fallopian tube is also getting excised with the ovary. That's because it was so intimately related to the ovary that it wouldn't have been possible to dissect the tube free. So the last part of the pedicle divided there, and the tumor is finally free of its attachment. Large blood clot from the fresh bleeding which occurred during the procedure. and you can see the pedicle is securely coagulated and not bleeding. Now, I did make an attempt to try and get this mass into a plastic bag, but it failed. Therefore, we had no choice but to make a small supraumbilical incision to. Well, I suppose it's one of the disadvantages of minimally invasive surgery that you try to skimp on your retrieval incisions. So I told my resident here that enlarge the incision, don't struggle with the tumor. So that was the main mass removed, and it was time to get rid of all the other debris. So that was the closure of the wounds. The child has been in follow-up care with our pediatric oncologist and is currently on chemotherapy. 1 year down the line, she remains well.